Fluent Podcasts, podcasts he never had before.
Hey everyone, welcome back to the Fluent Podcast, where we make English learning simple, real, and fun. I'm Chad.
And I'm Sarah. Today, we're taking you inside one of the most intense and important places in any hospital, the emergency room, often called the ER.
That's right. The ER is where people go when they have sudden or serious health problems that need immediate attention. Things like accidents, chest pain, or injuries.
And it's also one of the most language-rich environments for English learners. If you've ever watched a medical drama or needed medical help abroad, you've probably heard terms like paramedic, patient, or triage. Today, we'll explain them all clearly.
Absolutely. So let's start with our language takeaway, where we look at the most important vocabulary you'll hear in an emergency room.
Great idea. Our first keyword is emergency room, or ER. The ER is the department in a hospital that handles urgent and life-threatening situations. In the UK, it's often called the Accident and Emergency Department, or A&E.
Right. So if you're in the US, you might say, I'm going to the ER, but in the UK, someone would say, I'm going to A&E. Both mean the same thing.
Perfect. Now, the second word is paramedic. A paramedic is a trained medical professional who provides emergency care before a patient reaches the hospital. They usually arrive in an ambulance.
Exactly. You can think of them as the first responders, the people who stabilize patients and bring them safely to the ER. For example, the paramedics arrived within minutes after the accident.
Our next keyword is ambulance. That's the special vehicle used to transport sick or injured people to the hospital. It's usually equipped with oxygen, medical tools, and a stretcher.
Speaking of stretchers, that's our next word. A stretcher is a light bed with wheels used to carry patients who can't walk. You might hear, the nurse pushed the stretcher down the hall.
Great. Let's add another important term, triage. Triage is the process of deciding which patients need care first based on how serious their condition is. In the ER, nurses or doctors do triage to make sure the most critical patients are treated immediately.
That's such an important word. For instance, after triage, the nurse called my name and took me to an examination room.
Exactly. Now, let's talk about the word symptoms. A symptom is something that shows you might be sick. For example, fever, cough, dizziness, or pain. Doctors often ask, what symptoms do you have?
And that leads us to another essential word, diagnosis. A diagnosis is the name the doctor gives to your illness after checking your symptoms and doing tests. For example, the diagnosis was food poisoning.
Nicely said. Let's also talk about treatment. That's what doctors do to help you get better. It could be giving medicine, doing surgery, or even just recommending rest.
And sometimes that treatment involves stitches. When you cut your skin deeply, doctors use small threads to close the wound. Those are called stitches.
Right. And people often say, I had to get 10 stitches after I cut my hand. Here's another important word, injection. That's when medicine is given with the needle, also known as a shot.
Yes, and there's also IV, which stands for intravenous line. It's when medicine or fluids are given directly through a vein using a tube. You might hear, the nurse connected the IV to my arm.
Excellent explanation, Chad. Now, let's move on to the key phrases section. These are real English phrases you might hear or need to use in an emergency room situation.
Our first key phrase is, I need to see a doctor immediately. This is something you say when your condition is serious and you can't wait.
Good one. Another useful phrase is, I'm having trouble breathing. You should use this if you feel short of breath. It helps the staff understand it's urgent.
And here's another one. I think I broke my arm. When you use I think, it shows you're not sure, but you suspect it. It's a polite, clear way to describe what happened.
Another common one is, where's the nearest hospital? That's something people might ask in emergencies when they need help right away.
Great examples. Let's go a bit deeper with the phrase in critical condition. When doctors say someone is in critical condition, it means the person's life is in danger.
Yes, and it's different from stable condition, which means the person is sick or injured, but not getting worse. For example, the patient is now in stable condition after surgery.
I love that distinction. Critical means very serious, stable means under control. Another key phrase is, we need to run some tests. This is what doctors say before they check your blood, take an X-ray, or do a scan.
And you'll often hear, please describe your pain. That helps doctors know where and how much it hurts. For example, it's a sharp pain in my chest, or it's a dull pain in my back.
Exactly. Another phrase we often hear in the ER is remain calm. Nurses use it to comfort patients or family members when everyone's anxious.
Right. Emotional control is so important in an emergency room. Even the staff remind each other, stay calm, think clearly, and act fast.
Let's move into our grammar and context review section. Many English learners get confused about which verbs to use when talking about medical situations.
True. For example, you have symptoms, not are symptoms. You say, I have a headache, not I am headache.
Good point. Also, we don't say I did an operation. The correct form is I had an operation or the doctor performed an operation.
Yes, and when you receive care, you say, I was treated for. For example, I was treated for dehydration.
Another common mistake is using take incorrectly. You take medicine, but you get an injection. So I took painkillers, but I got an injection.
Excellent. Now let's highlight some extended vocabulary you might hear in the ER. The first one is fracture, which means a broken bone.
Right. You might hear the X-ray shows a minor fracture. Another one is bruise, which means a dark mark under the skin after you hit something.
Don't forget sprain, when you stretch or twist a joint too much, like your ankle. I sprained my ankle while playing soccer.
And then there's bleeding and bandage. The nurse stopped the bleeding and wrapped the wound with a bandage.
Perfect. Let's also include fever, nausea, and dizziness, 3 very common symptoms people mention in emergencies.
Absolutely. For instance, he has a high fever. She feels nauseous. And I'm feeling dizzy. These are everyday examples you can use.
Another key phrase you might hear is take deep breaths. Doctors say this when patients are anxious or having breathing trouble.
And one more, we're monitoring your vital signs. That means the staff are checking your heart rate, blood pressure, and breathing to make sure you're stable.
Excellent. Now let's move to the putting it together section, where we connect these terms into real-life conversation contexts.
Let's imagine we're summarizing a patient's visit. The paramedics brought the patient to the ER. After triage, the doctor examined him, diagnosed a broken leg, and gave him painkillers.
That's perfect. It uses all the key vocabulary: paramedics, triage, diagnosis, treatment, and painkillers. You can really see how these words work together in context.
Exactly. Another short example, she arrived at the ER with chest pain. The nurses did some tests, gave her an IV, and told her to remain calm.
That's a great model for how to describe an emergency event clearly in English.
Before we wrap up, let's go through a quick review of all the new words we covered today.
Sure. Here we go. Emergency room, paramedic, ambulance, stretcher, triage, symptoms, diagnosis, treatment, stitches, injection, IV, fracture, sprain, bruise, bleeding, bandage, nausea, fever, dizziness, and vital signs.
Perfect recap. And our key phrases, I need to see a doctor immediately. I think I broke my arm. Be calm. We need to run some tests. And in critical condition.
These are the building blocks of real English communication in medical settings, especially useful for travelers, healthcare students, and English learners preparing for tests.
Before we end, here's one more cultural note. In the US, the ER is often busy, so patients who aren't in critical condition might have to wait. That's why triage is so important.
Exactly. And it's always polite to stay calm and speak clearly with staff. For example, "Excuse me, can you please tell me how long the wait might be?" is a respectful way to ask.
Excellent advice, Sarah. All right, listeners, that's all for today's episode of Fluent Podcast.
We hope this episode helped you understand and feel more confident using English in emergency or hospital situations.
Don't forget to subscribe, leave a comment, and tell us how medical services work in your country. Do you say ER or A&E?
We'd love to hear your answers. Thanks for tuning in, and remember, keep learning, stay fluent, and take care of your health.
See you next time on the Fluent Podcast.
Bye, everyone.